Colorado Mesa University sits among the most amazing landscapes in the West. Few universities located in such a remarkable setting also have the benefit of having high quality and comprehensive medical services. Grand Junction is the largest medical hub between Salt Lake City and Denver, with not just one but 3 hospitals located only a few miles from campus. CMU is just blocks from a regional medical center, St. Mary's Hospital. In addition, Community Hospital is just minutes from campus. And for our student veteran population, the VA Regional Medical Center is just 2 miles from CMU. 1 university, 3 hospitals, innumerable benefit to students. Coordinating, measuring, and supporting this world-class healthcare infrastructure is one of Colorado's best and most nimble health agencies, Mesa County Public Health. They are with us today to discuss healthcare and the community health infrastructure in and around CMU. Joining us is Stacy, an epidemiologist from Mesa County Public Health. Thanks for being on campus today to discuss the health of the community and really what we're doing here at CMU.
Thanks for having me. I'm excited to be here.
So tell us just a little bit about what is an epidemiologist?
I'm actually really excited that people are starting to hear about epidemiologist, hear the term. What we do, our sole job is to contain infectious diseases, which kind of is a large bucket. So it includes case investigation, providing guidance for key partners in the community, really anything that we can do to try to make sure as few people get sick as possible.
So tell us just a little bit about your role and kind of your history and what you have done that has prepared you to be a part of this team that's helping our planning for the fall.
Of course. So while COVID is new, it's a new disease, respiratory illnesses aren't new. It's something that we work with all the time, be it pertussis, which is whooping cough, tuberculosis, measles. These are diseases. The guidance is somewhat similar for all respiratory illnesses in terms of how to contain them. And then contact tracing, which it's a new term for people, but it's actually something that we do all the time with those diseases as well. So there are many things that we have already been doing in the past that match up pretty well with COVID.
Yeah. So I know that, Mesa County Health Department, Community Hospital, St. Mary's have all kind of been working together on this CMU's plan around Safe Together, Strong Together. As we look at this planning initiative and all the long hours that you're putting in to help us in planning for the fall, you likely already have a really big workload going with response to the pandemic. Tell me just a little bit about the why behind why you guys want to be involved with us and have said yes to being on our team.
Of course. So CMU is such a large, important part of our community. So whatever we can do to help keep CMU and all the students that come here be as safe as possible, we want to do that. So if that means helping with the plan part, we're more than happy to assist with that.
We really appreciate everything you have done so far. And as we think about sort of your role as we move forward, what do you sort of see Mesa County Public Health's partnership with CMU and this planning initiative and kind of what that looks like as we continue to work through this planning process towards the fall?
So CMU has a lot of different committees coming up with a lot of different plans for a lot of different buckets, be it food service, the library, the outdoor recreation facility. So our role in public health, we've been serving as advisors. So CMU, all of those committees, they have done a great job of coming up with very thorough plans. So our role is to kind of look through those plans and poke holes, add whatever comments that we think need to be made, and then that way the plans can be as good as possible to create a safe environment for our students.
Yeah, and I think as we've created, the sort of the executive committee team and then, the 8 sort of subcommittees that are working together to kind of bring all these plans together, we really have relied on the expertise of you and your team to poke those holes and to overturn rocks that we may have not thought about. So just really appreciate, what you have done in the oversight to those pieces. And I think as we turn and sort of look towards what's happening now in Mesa County, we really have had a low incidence of COVID here in the county, and that has allowed us to open up a few things on campus in our phase 1 kind of reopening. Help me understand a little bit of, we've been able to open parts of the rec center and we're, opened up the bookstore, but still we're having other things that haven't been able to open up, like the natatorium. Help us understand a little bit about why we've been able to open up some things, but not other things across campus.
So, as you know, COVID is new, so there are still a lot of things that we don't know about it. For example, how well does it survive in water? But in addition to that, any time that we want to open more things up, we work really closely with the State Health Department, Colorado Department of Public Health and Environment in Colorado. So they have a pretty, we work well with them to kind of decide what is most appropriate to open up and what might not be safe right now.
Sure. And what are some of those things when we're looking for safety? You talked about some of the science behind what we do know about COVID and what we don't know about COVID. Help me understand a little more too about how that informs decisions about the reopening.
So we know that it doesn't survive well on surfaces. That's something that we have learned pretty recently. But we do know that also it's primarily respiratory. So being in a confined space, such as a car or a very small classroom, for example, for a long period of time, that puts you more at risk rather than being outside or being appropriately socially distanced like we are right now.
Yeah. I think those things are so important for us to think about as we're not only planning now for some of those reopening steps, but as we think about safety in reopening things so we can stay on course to make sure that in fall we're opening campus safely and welcoming students, faculty, and staff back to a safe place. So I appreciate some of that insight on what COVID looks like. So as we are looking at the future, where we're going with the planning initiatives and the process that's happening, looking at your contributions and what Mesa County Public Health has done to sort of guide that process, what do you get excited about in thinking about fall and the future of what that looks like here on the CMU campus?
Honestly, I'm excited to start seeing students come back to something like normal. It might not be exactly what it looked like before, but I'm excited to see, with all of our hard work and planning, an environment where students can come back and feel safe and continue as almost normal.
Yeah, and I think you're right? That's sort of the reinventing of this new normal on campus. And as we welcome students back, I do feel with your support and that of our medical and health advisory team that we can continue to learn more about COVID as those things come down. And what do you look at as sort of a resource or a source of getting a lot of information about COVID, and where can people go if they're interested in learning a little bit more about public health and the importance of that as we think about not only individual health but our community health as we return to campus?
So I highly recommend using direct sources, so anything from the CDC website, WHO, even our own website, health.mesacounty.us is a pretty good, we try to keep that updated with current guidance and what's going on in our community right now.
That's great. And kudos to you and your team at Mesa County Public Health. And if you haven't visited that website, that is a great place to make sure that you're getting a lot of information, because you and your team have done an incredible job of kind of outlining those pieces that are so important when we're thinking about safety as we come back together. So just really appreciate your time and willingness to be here with us today. Are there any other things that you really wish the CMU community knew about epidemiology, public health, as we're thinking about COVID and thinking about a return to campus? Anything that you would love our broader community to know as we face some of these unknowns with COVID?
Just know that public health exists outside of COVID as well. So while COVID is going on, it has obviously become top of mind. But even when COVID isn't happening, we're working very hard behind the scenes with many other reportable illnesses. It'll be flu season before you know it, so we work with that as well. Just knowing that public health is more than just COVID, it's always here.
Thank you again for your time and for your willingness to be here. I know that you and your team are very busy in all the work that you're doing with just helping us have a safe community. And so just really want to say thank you for joining us today. And We will be continuing to highlight some of our medical experts and community health advisory team. So stay tuned for more information coming out about COVID and our continued planning to make sure that we have a safe return to campus this fall.